Welcome to Full Throttle, where we sit down with the women shaping business, industries, and culture to talk about what really drives them. Lex, ready to go full throttle?
Yes.
Okay, let's start with some super quick questions.
Okay.
Non-negotiable daily ritual.
Oh, okay. This is a really good one. I think for me personally, I have to wake up and have some breakfast. I feel like that really sets me on the trajectory for the rest of the day.
What's your go-to breakfast?
I love oats, so some overnight oats. Really into my meal prepping at the moment. So some overnight oats or maybe some Wheat Bix or just a piece of fruit.
Mm-hmm.
At the moment, it's been after work a daily swim. I'm living on the South Coast at the moment, so I'll try to finish my placement and then get to the beach, and I feel like that just centers me for the rest of the night where I have to study and do whatever. They're probably my two non-negotiables at the moment.
I love that. They're so wholesome, obviously, and I don't expect anything less from you. Coffee or matcha?
Oh, definitely coffee. It's the Italian in me.
I asked you that like I didn't know the answer.
Yeah.
Go-to cocktail?
Ooh. At the moment, espresso martini. Yeah.
Beautiful.
Yep.
Nothing says med student like an espresso martini.
Oh, and keeping with the coffee trend.
Exactly. Knowledge flex. One fact you wish everybody knew about their body.
Oh, that's actually a really difficult one because there are so many different things.
Yeah.
I think keeping on the theme at the moment, I've been, I just finished my obstetrics and gynecology rotation. So I wish that, in terms of like the female cycle, I wish women knew that the influence the different hormones had at different points of their cycle and how that can affect, how they're feeling, their, different ways they can nourish their body and, how they might respond to different levels of training and whatnot.
So true. There's not enough about that.
No.
Okay, let's move into the hot take. Okay. I'm going to ask you questions about hot medical topics.
Okay.
Health information has never been more accessible, yet misinformation is everywhere.
Yep.
Why are we still getting it so wrong?
I think that's a really good question, especially in the era that we're in at the moment. I think that, over the past few years especially, thanks to artificial intelligence, there has been this massive surge in accessibility of medical information. However, I think that accessibility doesn't necessarily equal understanding. And that's for several reasons. I think if you look at AI specifically, everybody's got AI on their phone. It's in their pocket. It's a really great tool, but they don't necessarily teach us how to use it effectively. So a good example I can give is, let's say, and we've all done this, we've found a mole on our body that looks a little suspicious and we've had a panic about it. It's highly unlikely that in that highly, emotional state, you're going to say to your AI, what are the Australian criteria for identifying a skin lesion? It's going to be something along the lines of, I have a large black spot on my arm that has grown dramatically. I have cancer. What do I do?
Yeah.
And so, we don't necessarily know how to sieve through the information. I think that is going to become, an incredibly essential tool, especially moving forward as AI continues to grow and develop.
So true. So on the topic of AI, is it inaccurate? So if I ask ChatGPT something medical, how frequently does it give you an accurate answer?
I don't know how accurate it is from a statistic point of view, but I think it's important to remember that it is an algorithm and the algorithm is driven towards simplicity. It doesn't necessarily curate, the environment, information according to the environment you're in. So whether you're in Australia or America, there's going to be different guidelines and information. And then in addition to that, it creates a self-serving echo chamber a lot of the time because the answers that, it provides are highly dependent on what you specifically put in. Yeah. And it's, unlikely that we're going to be objective when we, make a request or we ask a question. So, from what I can see, there is a good level of accuracy, but it depends on the question you input. So,
that's so true.
Yeah.
I read something the other day about how ChatGPT is always positive.
Yeah.
And it kind of wants to agree with what you're saying all of the time.
Yeah, absolutely.
So it's like a self-fulfilling prophecy in a way.
Yeah, absolutely. And it's going to keep creating this growing chamber of, these positive, almost affirmations. It really does, in a lot of ways, lack the ability to be objective and point you in the right direction, especially if you're, designing the questions in a way that is going to be reinforcing.
Yeah. So interesting. Do you think the wellness industry has helped or harmed health literacy?
Another really good question. I think that there are I think that there are multiple lenses that you need to take when you look at something like the wellness industry. From a positive perspective, the wellness industry has, I guess, significantly contributed to the growth of positive health behaviors as that we see on a societal level. Now more than ever, people are interested in, how we're fueling our bodies, being physically active, mindfulness and wellness. And I think that, that's incredibly apparent. Even if you go on a social media platform like Instagram, you see people competing at, high rocks and all of these really cool things. So there's definitely a growing trend toward that. But a healthy bit of skepticism is also needed. So remembering that the wellness industry is an industry, and like any business, there needs to be sales and there needs to be profit. And so, the wellness industry uses a lot of anecdotal evidence. It uses a lot of storytelling and narrative. That doesn't necessarily mean that it's evidence-based. It just means that it's anecdotal. So, it does have this really positive side, but having that little bit of healthy skepticism is needed when you're navigating the products, and also learning how to use those products, because it doesn't necessarily teach you why you need the supplement or what it's trying to do. It's just that you need it because look at this person's before and after.
That's right.
Yeah.
So true. Why does storytelling matter just as much as science when it comes to changing health outcomes?
I think that storytelling is inextricably tied to the human experience, right? So, since the beginning of humanity, we've relied on stories as a way of communicating messages. If you think about, stories inscribed on cave walls or shared around a fire, and, now podcasts and, literature and whatnot, I think that we are creatures of narrative, and it's a way that we connect with other people. So if we can take, evidence-based science and we can translate it in a way that is communicated through stories, the research has shown that it's more likely to not only relate to people, but be understood and then remembered.
Wow.
So I think it's a really brilliant tool.
Truly. Do you think health literacy has historically been treated as privilege rather than public good?
I think that's a really hard question because, there is definitely historically, and if you look at the statistics, I mean, more than half the population in Australia have inadequate levels of health literacy. And that is particularly true for vulnerable communities. So I guess if you look at the correlation between higher levels of health literacy, it's usually in communities that have higher education, higher socioeconomic status. So I don't necessarily think it's been treated as a privilege, but there's definitely a correlation with
and a discrepancy
absolutely within society. And access is really difficult to maintain. It depends on, as we said before, socioeconomic status, where you live, what your cultural beliefs are, your trust with the healthcare system. So I think to make it democratized and equitable, it's a really wicked problem. Like there's not one silver bullet solution to kind of create equality in that space.
That's really true. How do you make it accessible?
Lots of different ways that you could go about improving accessibility. I think it depends on the specific issue you're trying to tackle, right?
Definitely.
So if you're trying to make resources accessible to rural communities, then it's about, starting rural hubs. It's about bringing the technology there, or using, video conferencing to communicate with doctors from metropolitan areas. But then if it's about, language barrier, then that's a whole different other approach. So I think it definitely depends on what specific issue you want to improve access with, if that makes sense.
Yeah, no, definitely. Okay, we're going to move into the blueprint. We're going to go behind the scenes of Alexia Paglia and the book you've written and your current medical studies.
Okay.
So take us all the way back.
Yep.
What was the moment that made you realise healthcare wasn't just something that you wanted to study, it was something that you actually wanted to change?
Okay. I think for me, it was when I moved into the clinical trial space. So I was working within oncology clinical trials at some of the hospitals in Sydney.
Wow.
It was a really brilliant experience. And I think for me, that really solidified my passion to want to pursue medicine. But also, I remember sitting in the room, watching all of the doctors consent patients onto the trials. And this is a really scary time for a lot of people. They're so vulnerable. They don't know what the future looks like.
Yeah.
They're sitting there with their families who are equally as distressed. And I saw a lot of people agreeing to things that I could see they didn't fully understand. And I'm not saying that at all was the fault of the clinicians in the room. It's just that, these things are complex even for us to grasp, let alone someone, who comes from, I'm just going to use my grandmother as an example, Italy, who doesn't really fully understand the language and she's distressed and whatever else. And so I realized then that not a lot of us know a whole lot about our bodies.
Yeah.
And I'm someone who's incredibly passionate about teaching, about storytelling. And I thought, imagine if there is a way that we could bring all of these things together, but actually do so, when children are young, when they're first curious about this knowledge, because the research has shown if we implement these behaviors at an early age, it's more likely to then, turn into lifelong healthy habits.
Definitely. And has that been lacking from the syllabus?
Yeah, think about when you were in school. I always joke about this, but I remember learning about, cows having however many stomachs before I learned, anything about my own body. Yeah, and I think I was so curious as a kid as well. I wanted to learn. My poor parents, I was always asking a million questions. So imagine that was integrated into the syllabus in a way that kids felt empowered and knowledgeable.
Yep.
Yeah.
No, so true. I know. I just remember the food pyramid for some reason.
The food pyramid and Healthy Harold.
Yeah.
I don't know. Does he exist anymore?
I don't know, but there was so much wrong with Healthy Harold.
Yeah.
You've worked across biotech, health data, clinical trials, and now medicine.
Yeah.
How did those worlds shape how you think about care holistically?
Yeah. Okay. So I think each of them, I guess they're in the same sphere, right? But each of them taught me something a little bit different. So if you think about the biotech space, biotech is all about business and innovation and discovery. And so that really, I guess for me, cemented the infinite capabilities that the medical and scientific sphere have, especially in the next, few decades.
Yeah.
Then if you think about clinical trials, it's about taking those discoveries and then running, safe tests on groups within the population that would benefit from those. So that really honed in those skills. And so I kind of started with the idea and then it was this is the idea in practice.
Yep.
And then medicine is really about bringing in the humanity and the compassion and treating the person holistically. And, how can we translate everything that we know into delivering the best health outcomes for that particular patient?
Yes.
So they kind of all cycled at different stages. It was, it's been really great.
What gaps did you notice early on that the system wasn't addressing, especially for young people and families?
I think similar to what we were speaking about before, that accessibility doesn't necessarily equal understanding. And so just because health information is out there doesn't mean that people know how to use it, know how to access it, or know how to then translate that into something meaningful for them. And so I felt that there was a real gap in that way. I think kids, traditionally have been so underestimated.
Yeah.
They think, they won't fully understand, or this is, they can learn about this when they're older. But I think some of the biggest lessons in my life were learned in childhood and then kind of carried with me. So I think that, really using that to our advantage and trying to create tools that are uniquely tailored to younger children
so
that it does develop into these healthy habits.
Amazing. How do you translate complex science into language that empowers people?
I was actually talking about this with someone the other day. We're getting into a bit of a discussion about it because I hate the word dumbing it down.
Yes.
And I think that with kids, people think, we need to dumb this down. Rather, I think language itself needs to be redesigned in a way that's going to be best perceived by them. And that's where the whole storytelling and literature aspect of what I do comes in.
Yeah.
Kids respond to anecdote, to metaphor, to rhyme, to all of these literary devices. So I really tried with the first book to incorporate all of them into the message I was trying to deliver.
Yep.
So it's what was the main message and how was I going to change or design my language so that, the children reading it would take that away.
Yep. Tell us about the book.
Yes. I love talking about the book.
How did it begin? I know. I love hearing about the book. Please go ahead.
So My Strong Heart is the first book in a series of children's books that all focus on a different organ or system in the body. So My Strong Heart talks about the heart, hence the title, how it functions, how to keep it healthy, what it does. I guess, I think when you ask any kid, what does your heart do? They're kind of like, oh, it sits somewhere here.
Yeah.
And it has something to do with keeping me alive.
Yeah.
But I wanted them to understand how it does that and how they can keep it healthy and then share that information with others.
Yeah.
So that's what that book does. But the idea is to build a series of books that all focus on different organs or systems and then eventually get into different pathologies. So what is cancer? What does it mean, etc. So
wow. I think that will be so important, not just for children, but for everybody.
Oh, absolutely.
In a way that does make it digestible, but as you said before, it's not dumbing it down. It's just simplifying it in a way that you can understand and remember.
Yeah, for sure. And it's a whole family experience. That's why I wanted to create the children's book.
Yes.
It's very rare, unless this child is very intelligent, that at 3 years old they're picking up a book and reading it. So it's the mum or the dad reading it, and so it sparks conversations within the whole family. And I think that's what's so important, in instilling a positive culture.
So true. As someone currently studying medicine, what do you do to hold your confidence while you are still learning?
Yeah, I think this can be really hard at times. And I don't want to say that I'm, great at this, because I'm still learning about how I can remain confident and resilient.
Yes.
When it's a field that is, I guess, characteristically, you're going to not be good at things or you're going to fail. Yeah. I think that with medicine, it is this sphere that is constantly growing and evolving. And it doesn't matter if you sit in your chair studying for 5 hours or 12 hours, there's going to be things that you don't get to or you don't learn.
Exactly.
So I think the first thing would be getting comfy with the idea of failure, knowing that I'm not going to be good at everything. And that's okay, because failure is such an important moment to, self-reflect and to learn and to grow. I think the other thing as well that I've been really trying to do this year would be self-reflection. So I have a little notepad that I bring with me to clinic. Yep. If something really good happens, like the other day, I'd kind of helped one of the clinicians come up with a management plan that they agreed with. I was like, great. But I was like, I'm proud of that. Like I've gotten this right. This is really cool. So I wrote that down. Yeah. But then I was in theatre the other day and one of the surgeons pointed to an artery and I was humiliated because I forgot which one it was. And I also wrote that down. And it's about going, okay, like, yeah, cool, you felt embarrassed, but what can you do about that? Yep. Maybe I need to study up for an additional hour about, I don't know, the anatomy of that on the day, whatever it is. But it's good to self-reflect and be conscious of those things.
Absolutely. And I think with medicine as well, it is constantly changing and developing and new things are found out, new studies. So it's something that I guess is going to be, I don't want to call it a problem, but it's going to be something that you'll have to face for your entire career, right?
Absolutely. And I feel like, I don't know, I look at all the people in my year, everyone's like such high achievers and we're so scared of failing. But it's kind of like, there's so much growth in it that I'm trying to reimagine how I think about the concept as well.
Yeah, totally. On to the next segment, in good taste. So I want to know your icon, your indulgence, and your inspiration. Start with icon. Can be anything or anyone.
I feel like I don't want to sound cliche, but my icon has always been my mum. I think that she is somebody who, has always had so much integrity and authenticity in what she does. And, she's not in the medical field, but she's really succeeded within, her trade and her business that she's pursuing. And from a really young age, even though she might not have known the answers to the questions that I've had, she's always done such a brilliant job at trying to answer them and connect me with the right people. And, she's really just been this brilliant inspiration in my life. So she's my icon.
I love that. Shout out to Nat.
Yeah, shout out to Nat. She's brilliant. Like,
she is.
She's a queen.
Indulgence, something you wouldn't give up.
Ooh. I think you know what I was about to say, but I won't say it.
Yeah.
Those books.
So you have to say it.
Okay. At the moment, I feel like one of the only things keeping me sane is like fantasy literature.
I love you and everything about you, but this is like the one thing that I'm like, why are we friends?
It's honestly, no, I think because I'm going to justify this for you. I'm constantly studying and I'm constantly having to think. So when I pick up a book, I don't really want to think. Like, so I will absolutely read Fourth Wing and be happy about it. Like, it's just, yeah, that's been my indulgence at the moment, keeping me sane.
Okay, I'm going to accept it. Everyone.
Yeah, you've got to accept it.
Okay.
I actually think you should start reading.
I'm not. There is literally no fibre in my being.
I love fantasy.
Start
it's
reading
so
those
good.
Books.
It's like a break from reality.
Okay, I do get that.
It's good.
All right. And finally, inspiration. Anything or anyone
that inspires me.
Mm-hmm.
I think I'm really lucky that I'm in a profession where I'm constantly interacting with people who inspire me.
Yes.
You know, I've found at least 2 people per rotation at the moment who I really look up to, and I say I really would love to be the type of clinician that you are. And a lot of the doctors aren't just clinical. A lot of them do have advocacy positions and are contributing to policy and education and whatnot. So I think that there's too many people to name.
Of course.
I can name them, but there's a lot.
Yeah.
But yeah, people who are well-rounded, who care about the patients that they're treating as a whole person, not just the condition.
Yes.
That is so important.
Yeah, it is.
And also who are positively giving back to their community and trying to create better health outcomes for everybody.
I really, really love and respect that. Our bodies are so nuanced and we're all so different that it is so important to consider the whole person rather than just a condition.
Absolutely.
And it can become so easy just to not focus on that.
Yeah.
And especially when you're exposed, being a doctor, you're exposed to those things every single day.
Yep.
It's really easy to not be able to separate the person from
absolutely. And I think I thought coming into this profession that there was this figurative switch that I needed to flip off so that I could, do my job well. But I'm someone who is, very empathetic and naturally quite cathartic.
Yes.
And I learned very quickly that I'm happy that I feel that way. I'm happy that I get sad when I see someone going through something.
Yeah.
I think it's just about acknowledging that emotion, learning not to switch it off, but to maybe dull it a little bit at that point so that you can deliver the best, care that is objective and that is, right for that particular person.
Yeah, so true. Okay, we're going into unfiltered.
Okay.
Some of the more juicy questions. What's been the hardest moment emotionally where your purpose has felt heavier than inspiring?
I think that would probably have to be in the year that I got into medical school.
Yes.
It was probably the beginning of that year. I'm not sure if you know much about the process. So you have to sit that entry exam and I'd previously sat the GAMSAT and I'd gotten a decent score, but I didn't think it was competitive enough. So I'd registered to sit it again. At that time, I was working full-time. I had just started a graduate diploma, so I was studying full-time.
Yeah.
I was tutoring. I was trying to write the book. I was just so inundated. And while all of that stuff was going on, I had a lot of just personal circumstances that were coming up. My mental health wasn't the best.
Yeah.
The exam came and I think it was systems overload. I'd pushed myself to the point of burnout and I didn't get a good score. I actually failed one of the sections in the exam.
Yep.
So at that point, I think the future that I wanted to create felt so distant from my reality.
Yeah.
And I just did not know how I was going to activate that. And I remember taking a very long shower because that's what I do when I'm sad.
Yep.
And my mum was like, this is why I love Nat. She was banging on the door and she was like, Alexia, you can either continue to waste my water bill or you can acknowledge that you're sad.
Yeah.
You can sit in your desk and you can work out another path. You can work out a way to come back from all of this. And in hindsight, I'm so happy that I failed that test.
Yeah.
Because it taught me so much about myself.
Absolutely.
Yeah.
Have you ever felt underestimated, A, for your age and B, gender?
I think look, there have definitely been situations where I have felt underestimated more because of my age.
Yeah.
Whether or not those people actually did underestimate me, it could have very much been a projection of my own insecurities.
Yeah, totally.
But yeah, definitely. I think that, especially with the book and everything, I'm a novice in the space. At the time I published it, I was 23. I hadn't even started my medical degree yet. I'd just, done my undergraduate degrees. And so I think, it's a pretty fair thing to underestimate me. But I learned pretty quickly that I didn't mind it because it was an opportunity to really prove people wrong, prove myself wrong as well more than other people.
Yeah.
And I learned quickly how to, stand in a room full of people that, were well beyond my years that I admired and hold my own.
Yeah.
And that's a skill that, you need throughout life, I think.
So true.
Yeah.
Yep. How do you cope with the pressure of being seen as a role model while you're still figuring things out yourself?
Yeah. That's a really good question. I think one of my favorite parts of this whole journey has been the fact that, young women especially feel like they can contact me, whether they reach out on social media or sometimes it's through people that they know me that, someone will send my number. And they ask me for advice about how they can get into the medical field, or maybe they're really passionate about advocacy. What can they do? I absolutely love that. I think it's just so nice. And I was really fortunate to have a lot of brilliant mentors within my journey. So for me, this is like so amazing that I can give back in that way.
Yes.
I think I really try to acknowledge that I absolutely do not know everything. I try to be authentic in my approach and reflective. This is what worked for me. This is how I think those lessons might transpire to your own journey. And kind of hold that sense of integrity when I have those discussions.
And you're a very honest person by nature. So being able to project that in the way that you mentor people.
For sure.
Makes sense.
I love that. I think one of my favorite moments throughout this whole experience has been when my high school invited me to come back and say a speech for their graduation. For me, like, they asked me to talk about success and also failure. And it was a really honest speech. And I really hope that, those girls in the audience took those lessons away with them. And in no way did I stand up there and say, I've got all the answers and look at what I've done. Absolutely not.
Because you've been in their shoes and you appreciated the honest and transparent communications that you were giving at that time.
Absolutely. Because that's where the real growth happens.
Exactly. 100%.
No one wants to hear about someone that, was born into success, remained successful. And then, it's the journey and the experience 100%. That we can relate to.
Definitely. And that is the principle of this podcast. So that's why I love that you're here.
That's why I love the podcast.
Right. You were Young Sydneysider of the Year. Forgot to mention that one, didn't you? Tell me about that.
That was such an incredible experience. That was last year.
That flew.
I know, that literally flew. That was in 2024. It was, I think, mostly in acknowledgement of the work that I was doing with the book, with advocacy.
Yes.
And in addition to the book, I have a school program that I'm trying to implement amongst schools to raise awareness of health literacy, to teach these concepts to the kids. So I think that was an acknowledgement of everything together as one. It was so brilliant to be able to kind of have a platform at which I could talk about things that I was so passionate about. For me, that's what that acknowledgement meant. It meant that I now had a little bit of a platform where I could reach larger amounts of groups and raise awareness for all of these super important things. And it felt really nice to feel supported by the greater community and that people resonated with what I was trying to do. So that was an incredible honor last year.
Absolutely. And very well deserved. And you worked super hard to get there.
Thank you.
We kind of spoke about this before.
Yeah.
But how do you protect your empathy in a system that can sometimes harden people?
Yeah. Like I said before, I went into medicine thinking there was this figurative switch.
Yeah.
And that I had to walk into the room, shut off my emotions and just deal with the problem.
Yeah.
And it wasn't until I started placement that I realized, probably within the first week, that that was just not going to happen, especially for someone like me. And I also didn't want that to happen.
No.
I liked the fact that, when I saw, an old man talk about how he wanted to make it a year so he could be at his granddaughter's wedding. Like, I liked that. I felt sad.
Yeah.
Because, it is sad.
It's awful.
It's awful. And these are people who are going through some of the most vulnerable and difficult times of their life. And I think, I hope that when I eventually graduate and become a doctor, I can be the kind of doctor who relates to that humanity and is compassionate and treats the person as a person rather than the condition that they have.
Yeah.
But then, you don't want to be entirely driven by your emotions either. So it's just learning when to kind of acknowledge the emotion, dull it back a little bit and say, what do I know or what can I do that is going to deliver the best possible outcome for this person?
Yes. Exactly, without clouding your judgment.
Absolutely.
Right, we're going to move into For the Record. What does the future of healthcare look like if health literacy truly becomes mainstream?
I think that in order for health literacy to become mainstream, it will need to be, integrated in a way that addresses the specific needs of different groups.
Yeah.
So as we said before, vulnerable groups within society are particularly affected by low levels of health literacy.
Yep.
So if we integrate it in a way that addresses those unique needs, I think it means, everybody feeling empowered to captain their own healthcare journey.
Yep.
People being aware of their bodies, how they function, what they can do if things start going wrong.
Yep.
People knowing how to access and navigate care. And then as a result of all of those things, I guess curbing otherwise preventable illnesses. So I think it kind of comes into this full circle synergy.
Amazing. You're amazing.
You're amazing.
You're fucking amazing. Where do you see yourself sitting long term? Clinician, educator, policy shaper, all of the above. What does it look like to you?
I would really love to imagine a future where I can be all of those things.
Yeah.
I kind of see myself as this is a interesting analogy, but have you seen Inside Out?
Yes.
Yeah.
I have.
I love that movie because I think it again redesigns emotions in a ways that kids can really understand. In the control panel upstairs, you know how they've got the different islands for the personality. I kind of see, I would love to imagine a future where there's Alexia as a call and then there are these different islands of my professional development. So there's the educator who's in the health literacy space. The author who's continuing to pursue these books. There's the clinician that, really cares about her patients and who they respect and that they trust. So I think kind of creating those islands for myself.
Amazing.
And yeah.
If anyone can do it all, it is you.
Oh,
no, really.
I don't know about that.
I do.
You're too kind.
No. What does legacy mean to you at this point in your career?
I think legacy for me, doesn't mean being remembered as I don't really care for that.
Yep.
It's more about, while I am, in this career, what can I contribute that's positive?
Yes.
How do people talk about me when I'm not in the room? I want to be, I guess, considered as someone who is respectful, who is, trustworthy, who is always, willing to give back and has time for people and is compassionate in my clinical practice, in my advocacy, whatever it is that I'm trying to do. And I think from a project point of view, it would be contributing to something that has lasting, meaningful impact, within the community.
Yep. That is beautiful.
Oh, thank you.
And finally, the scary goal.
Okay.
What is the ambition you haven't said out loud yet because it feels audacious?
Oh, I think I want to think about this because
do that.
I think an ambition that I haven't yet said out loud would be that I would love to create a program that is kind of facilitated nationally for health literacy, and I'd love to contribute to that. I don't know exactly how that looks because obviously different states have different education systems and they're governed by their own bodies and whatnot, but I would really love if my books can be integrated nationally, that they become a household name, and that people really value the messages within them, and recommend them to each other from in a project sort of way.
Amazing.
That would be great.
So proud of you.
Thank you.
I'm bursting with pride.
Thank you.
You are incredible.
Thank
you're
you.
So inspirational. And I think we've only just scratched the surface.
Thank you. I feel the same way about you with everything that you're doing.
This is not about me.
No, but still.
I love you. And thank you for coming on the pod.
I love you too. Thank you so much for having me. And yeah, it's been really so special. So thank you.
One moment.
I love that.
Because it's you. It's so much worse.
Yeah, sorry. I thought about that in the car on the way here. I was like, am I pretending I don't know who Pog is?
Literally, there are so many things that I was about to say. I was like, no, I cannot say that on a podcast.
Okay. Remember in New York when...
All right, 1 second. Okay.